So we see the two models, upper and lower, and we will see the demonstration on how to create a simple coping using what is called the Adapta system. The Adapta is the name of a system. It's a plastic foil, actually it's polycarbonate. One is 0.1, the other one is 0.6 millimeters. Actually, the big one, the thick one, is the support for the coping. So they are clamped together and they are warmed. Of course, before doing this, we have to prepare the abutment. We know this very well. We have to isolate and space it and isolate it. The die spacer, as we know, has the role to isolate and to create kind of the space for the cement. Yes, the cement is around 20 to 40 microns. You need like 4 or 5 layers of spacer. You can't apply them one over the other because it will exfoliate. It's kind of tricky. So the best way is to do the spacing with wax, and then just a layer of spacer would be enough. Otherwise, you have to wait like 15 minutes in between the layers of spacer that you apply, and wow, that can take 1.5 hours just to prepare the abutment. Right, so anyhow, so you have it prepared, right? Now the abutment is prepared with the spacer, with the isolation, with everything, yeah? Isolation is not so very important in this case because there's no wax to stick to the die, the plaster die. So you just adapt it, thermally adapt it to the situation. And you see that down there, the technician in front of her, she has some sort of a putty material in which she will insert actually the die through this plastic material, which is some sort of polycarbonate. You see, just press there, and what we get exactly what the wax would have done if you placed the die in melted wax. That's the whole thing. Now you can cut this coping, and this is the problem. You have a coping now, but the wax that you place upon it doesn't stick very well to it, so that's kind of tricky. Some people still use this technique. So that's the 0.6 plastic material. And now we will take wax, cervical wax, in order to adapt it, to adapt the margins. So we cut it short of the margins, and now we adapt the margins perfectly with wax. Yes, the advantage is that it will never break. If you did that in wax and you were a little bit not paying attention, you could break the whole thing. But this one is perfectly stable, so you can't break it. This is the only advantage. Otherwise, actually, there's no advantage. And yes, there is another advantage, that this does not contract like wax. So that's true. There are some advantages, but the huge disadvantage is that the wax is not actually sticking to this material. It does, but not so well. And of course, upon this, we create the pattern of our crown. See, same technique, starting with the cusps, and then slowly adding, checking in the occlusion. Yeah, white was for the active cusps and yellow for the inactive cusps. It's just for demonstration purposes. Yeah, normally technicians don't do it like this. So you see the cusps in their respective order. The crest, animal crest, oblique, and animal crest, that is clearly seen there. And if you have it right in occlusion, that's fine. You can prepare the coping, actually the wax up, for investment, that is for transforming it in metal.